Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about ICD-10 CM PCS updates 2023 third quarter part 4. In this video, we are going to learn about two coding clinics. The first one is how to report PCS codes for application of the hemostatic clip and hemospray. Would they be reported separately? And the next coding clinic is how should gunshot wounds described as blast injuries of the jejunum, cecum and right colon be coded. When blast injuries are documented, how will one distinguish between primary and secondary? So these two coding clinics we are going to cover today. Let's start with the first one. How to report PCS codes for application of the hemostatic clip and hemospray. Would they be reported separately? Let's go to the scenario. A patient presented for small bowel enteroscopy secondary to melena. So in this scenario, the patient is having melena and he presented for small bowel enteroscopy. Small bowel enteroscopy is a procedure to examine the small intestine. Okay, so the patient is status post gastric bypass. The patient has already underwent gastric bypass. What is gastric bypass is? That is a type of weight loss surgery that involves creating a small pouch from the stomach and connecting the newly created pouch directly to the small intestine, that is jejunum. The patient is status post gastric bypass and the gastrojejunal anastomosis was characterized by ulceration. Now the patient has developed the ulceration at the gastrojejunal anastomosis site, as you can see it in the image. So there was an oozing from the periphery of the ulcer and that would not stop bleeding. So the patient has developed the ulcer at the gastrojejunal anastomosis site and it was bleeding. A hemostatic clip was placed with continued oozing. So what the physician has done, he has placed the hemostatic clip there in order to control the bleeding, in order to stop active bleeding. Hemospray was then also applied. Now the physician also has applied the hemospray. The question is, would both the application of the hemostatic clip and hemospray be reported separately? And the answer is yes, both the application of the hemospray and the hemostatic clip would be reported separately. Let us go to the index and search for hemospray. It will lead you to use instruction, use mineral based topical hemostatic agent. Now we'll go to the use instruction. As per the use instruction, we'll go and search mineral based topical hemostatic agent in the index. It will lead you to the code XW0. Now let's go to the tabular and search for this code. XW0. X is a section, that is new technology. W is the body system, that is anatomical region, and 0 is a root operation. Introduction. The fourth character is body part, and body part should be taken as upper GI because the procedure is performed at the gastrojejunal site, and the approach is via natural artificial endoscopy because the procedure was performed with enteroscopy, and the device is mineral based topical hemostatic and qualifier is new technology. So the code will be XW0G886, that is introduction of mineral based topical hemostatic agent into upper GI via natural or artificial opening endoscopic, new technology group 6 for control of bleeding using hemospray. So this is the code for hemospray. Now we'll search for the code for hemostatic clip placement. So hemostatic clip is placed for control of bleeding, to control the bleeding. So we'll go to the index and search for control of bleeding in. Under the subterm, we'll get gastrointestinal tract because the process performed at gastrojejunal anastomosis. So gastrointestinal tract to be taken. So it will lead you to the code of 0W3P. Now go to the tabular and search for this code and it will lead you to 0W3P and the fifth character is approach. So approach should be taken as via natural or artificial opening endoscopy because the procedure was done enteroscopically, and no device. Device is no device and qualifier is no qualifier. and you'll get the code of U0W3P8ZZ. Control bleeding in gastrointestinal tract via natural or artificial opening endoscopic for the application of the clip to control the bleeding. The section X code for application of hemospray does not include the additional techniques used to control bleeding, such as clip placement. In cases where additional techniques are used to control bleeding, along with application of hemospray, separate codes are reported to fully describe the procedures performed. So, we have to take two separate codes, one for the hemospray and one for the hemostatic clips. Okay, now let us move to the next scenario, next coding clinic. Okay, the question is, a patient presented to the emergency department with a gunshot wound to the abdomen with extensive internal injuries following a firearm assault. During surgical exploration, the provider noted a bullet hole in the mid-jejunum with significant blast injury requiring removal of a segment of the small bowel. The surgeon documented massive injury, blast injury to the cecum and right colon, requiring right hemicolectomy. Depending on whether the wound is described as blast injury or a gunshot wound, coding professionals may arrive at different codes. Now the question is, how should gunshot wounds described as blast injuries of the jejunum, cecum and right colon be coded? When blast injuries are documented, how will one distinguish between primary and secondary? Okay, for this, we'll go to the index and search for gunshot wound. And under gunshot wound, in the subterm, we can see internal organs because the gunshot wound is at the internal organs. So it will lead you to C instruction, that is injury by site. Now we'll go to the injury and under that we'll search for the site, that is intestine. Intestine, under that large intestine, more specific subterm, and under that ascending right colon because it was the injuries was happened at the right colon. And below that you can see blast injury is documented, blast injury primary and blast injury secondary. But here we should not take this blast injury code or blast injury primary or blast injury secondary codes. Instead of that, we have to take it as specified type not elsewhere classifiable code. So S36590 is the correct code. Why? Because in ICD-10 CM, gunshot wounds are classified as puncture penetration wounds, whereas injuries due to explosions are classified as blast injuries. So in this scenario, there is no explosions documented. While the documentation refers to blast injury, codes for primary blast injuries are reserved for injuries resulting from high pressure due to an explosion. So here the primary is reserved for injuries resulting from high pressures due to an explosion. And codes for secondary blast injuries are reserved for penetrating injuries resulting from blast winds that propel fragments and debris. So these codes are reserved for explosions and blast winds. So this blast injury primary and secondary should not be taken. Instead, we have to take it as specified type not elsewhere classifiable code. And similarly, the injury was also happened at the mid-jejunum, that is small intestine. So in the index, we have to go for injury, intestine, and under that we have to search for small. And under the more specific subterm, we have to take specified type, specified site not elsewhere classifiable. And here also we should not take blast injury primary or blast injury secondary, as we have discussed earlier. So the correct code would be S36498A. We'll get two codes. The first code is S36498A, that is for other injury of other part of small intestine, initial encounter for the gunshot wound blast injury to the jejunum. And the next code is S36590A, other injury of ascending right colon, initial encounter for the gunshot blast injury to the cecum and right colon. And along with that, we have to also assign assault code, assault by unspecified firearm discharge, initial encounter, to describe the intent and mechanism that caused the injury. And code also any associated open wounds of abdominal wall and peritoneal cavity.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.